Polycythemia vera is a rare chronic blood disorder characterized by the overproduction of red blood cells and often white blood cells and platelets. Polycythemia vera is classified as a type of myeloproliferative neoplasm, which is a group of diseases that cause blood cells to grow abnormally in the bone marrow. This excessive production is due to a mutation in the bone marrow stem cells, most commonly in the Janus kinase 2, or JAK2 gene. Normally, erythropoietin produced by kidneys activate JAK2 gene. This causes the cell to divide and thus produce blood cells. JAK2 gene mutation leads to the continuous activation of the signaling pathway, which promotes the uncontrolled proliferation of blood cells, even in the absence of erythropoietin. The symptoms can vary widely among individuals and may develop gradually over time. Common symptoms include reddening of the skin or plethora, fatigue, headaches and dizziness, itching, especially after a warm shower or bath due to elevated basophils and mast cells, which contains histamine that causes itching when released. In more severe cases, polycythemia vera can lead to complications such as blood clots, which can cause strokes, heart attacks, deep vein thrombosis, or Budd-Chiari syndrome, splenomegaly due to excess red blood cells build up in the spleen, which usually helps to remove excess cells, peptic ulcers, gout, and kidney stones due to high levels of uric acid caused by increased red cell turnover. Over time, bone marrow cells start to die out and form scar tissues. At that point, bone marrow can no longer produce blood cells, resulting in anemia, leukopenia, and thrombocytopenia, and this is called spent phase. Over time, PV can progress to more severe conditions such as myelofibrosis, scarring of the bone marrow, or acute myeloid leukemia, or AML in less than 5% of patients. Diagnosing involves a combination of clinical evaluation and laboratory tests. Key diagnostic criteria include elevated red blood cell mass or hematocrit levels, and sometimes elevated white blood cells or platelet count, low levels of erythropoietin in most patients, and the JAK2 mutation. The primary goals of PV treatment are to reduce the risk of thrombosis and manage symptoms. Treatment options include phlebotomy, or regular removal of blood to decrease red blood cell volume. Myelosuppressive medications such as hydroxyurea or ruxolitinib, which is a JAK2 inhibitor, help to reduce red blood cell production. Aspirin may be used to reduce the risk of blood clots. In the spent phase, patient may need blood transfusions at regular intervals.